Okay, good afternoon, everyone. Thank you for joining us for the May 18th edition of the local COVID situation report. My name is Brittany Cadence. I'm the communications manager at Peterborough Public Health. It's our pleasure to share the latest information and insights into our local COVID statistics and guidance and vaccination effort and all the things that are COVID. Let's take a moment to give thanks and honor the beautiful place that we have the privilege of calling home. We respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. Okay, so now I would like to invite our board chair, Mayor Andy Mitchell, to start us off with some opening remarks. Please go ahead, Andy.
Thank you, Brittany. Although there are many hopeful signs in the battle against COVID-19, last week in Peterborough was not a good one in terms of controlling the pandemic. Our weekly case counts rose to 91, up 72% from the previous week's total of 53, and is the second highest weekly total of the entire COVID-19 emergency. Close contacts have also risen sharply, and is requiring resources to be deployed to contact tracing, resources we would rather deploy on vaccine rollout. There is a cautionary tale in all this. COVID-19, especially variants, continue to circulate in our community. Close contact with others outside your household place you at risk and should only be undertaken for essential purposes. For now, traveling to your cottage should only be for an essential reason, like required maintenance, and should not extend beyond 24 hours. If you are coming to stay for the summer, you need to self-isolate for the first 14 days you are here. We all want to see our seasonal visitors return, just not until the stay-at-home order is lifted. This is not the time for getting together at the cottage, for social gatherings, or for having a party. I know that these prohibitions will be difficult to endure this long weekend. After 15 months of lockdown, 5 weeks of a stay-at-home order, warm weather finally here, and the talk of herd immunity from vaccine rollout making it seem a current rather than a future reality, the last thing we want to do is to continue to stay at home away from extended family and friends. Please know, however, that by continuing to adhere to public health guidelines this May long weekend, you will help to achieve our goal of making this long weekend the last with such severe restrictions. This doesn't mean you can't do many of the things you often do. Get outdoors, work in the garden, order out for your favorite food or beverage, be close to the ones you love. Just do it this weekend with members of your household. And when you're out, keep 2 meters distance and avoid non-essential travel. We've come a long way, and the people of Peterborough City and County deserve a big thank you for your efforts. But as the last week has demonstrated, COVID continues to exact its toll, and we need to continue adhering to public health measures, even if it is the May long weekend. Stay safe, be well, and in all things, be kind. Thank you.
Thank you very much, Mayor Mitchell. All right, so now I will invite Dr. Salvatierra to lead us through these next few slides. Please go ahead, Dr. Salvatierra.
Thanks, Brittany. So as of 4:30 p.m. yesterday, our active case count has increased again to 103 active cases, up from the 89 cases we reported on Friday. We continue to see the variants of concern as our dominant strain in circulation. It's mostly B117. We're also back up to over 300 well over 300 close contacts. If you can see in the dashboard here, a total of 315 individuals that my team is now following as high risk. And that is 88 more than we reported last Tuesday. Sadly, we are also reporting another death, bringing the total number to 18 local residents who have lost their lives to COVID-19 since the pandemic began. Next slide, please. As Mayor Mitchell has noted, last week's total local case count was the second highest of the pandemic, with 91 new cases reported. It's certainly disappointing to see 3 weeks into this stay-at-home order that we are actually seeing local cases increase instead of decreasing along with the rest of the province. We've examined the characteristics of our recent cases since April 1st and find that the majority are among our 20 to 29-year-olds, and that the most common type of exposure was in the household. Our data seem to indicate that it is indoor social gatherings and household spread that are playing a significant role in increasing the numbers of cases. It's a good thing that vaccination opened up today for everyone 18 years of age and older, because we'll definitely need to target those 20 to 29-year-olds, especially those who are sharing their accommodations with others, to bring our case numbers down. Next slide, please. So here's the monthly bar graph, and you can see that our current case count for the month of May stands at 167. Next slide, please. We continue to show slightly more men than women. And as I already mentioned, the biggest growth in cases is among those who are under 29 years of age, with 40 of our new cases in in the youngest age bands just in the past week alone. Next slide, please. The percentage of community spread remains the same, with 19% of cases where we are unable to determine acquisition. The rate of those exposed from close contacts is also holding steady, just over 76%, at the same as last week. Our next slide shows the testing data. We've tested an additional 600 people in the past week, so that now represents about 35% of our total population that's been tested at least once. And as far as outbreaks go, our two new workplace outbreaks were declared over in the past 2 days, bringing the active outbreaks to 4. So as we face this recent increase in the total COVID cases, I'd like to focus my remarks on the last week, on the long weekend. The weather today is glorious, and the forecast is looking beautiful for the upcoming Victoria Day holiday weekend. I am very concerned about what appears to be a growing trend in socialization that will lead to even more cases. With the stay-at-home order extended until at least June 2nd, it does mean everyone will need to modify their plans and only leave your primary residence for essential reasons. Trailer parks and campgrounds are off limits this weekend. If you are traveling to a secondary residence, including a trailer in a park, for essential maintenance, you must go alone, and the trip should be less than 24 hours. So as Mayor Mitchell has said, this is not the season opener for the cottage. It is not the time to gather with family and friends. Longer stays at your seasonal residence are only permitted if you are relocating there for the summer, and they should start off with the first 14 days alone in isolation in order to protect the rest of us. So what can we do instead? We are so lucky in the Peterborough area to have an abundance of parks, green space, and natural areas to explore. So I encourage you to leave the car in the driveway and get out this long weekend for a walk, for a bike ride, or a hike. Hit the trails. Wear a mask if distancing is a challenge. But the trilliums and the other spring flowers are gorgeous right now. They truly are a sight to see. Another way to treat yourself this long weekend is to take advantage of curbside pickup being offered by many of our local restaurants and enjoy the comfort of your own home, your own balcony, or your backyard. I recognize that many of you would rather be going to visit friends, camping, or perhaps spending a weekend at your cottage or trailer. But unfortunately, this is just not the safest thing to do right now. As I have said before, COVID-19 does not have legs, humans do. We are responsible, sadly, for moving the virus around and for spreading it to others. We've observed a spike in COVID-19 cases after every long weekend since the start of the pandemic. And so I challenge everyone in Peterborough to set a new record. Let's make this a long weekend where we actually have cases going down instead of up. And here is a short message that our amazing communications team has put together that will be airing this week.
My apologies, folks, if you didn't see that, and my apologies for the intermittent stream there. I guess we're still just dealing with some challenges, but I do have the link that I can share with everybody. We've also shared this video that just shows the spike in cases following the Easter long weekend, and we've shared that already on our social media feeds. So anyways, my apologies. Back to you, Dr. Salvatierra.
Okay, thanks, Brittany. So as Andy Mitchell has said, let's make this our last lockdown and let's all follow the stay-at-home order so it can be safely lifted when June 2nd rolls around. That's just around the corner. A quick update on the vaccination front. As I mentioned earlier, all adults 18 years and older are now eligible to book their appointments. More appointment times will open up next week as our vaccine allocations are confirmed. So please check back to the provincial booking system regularly. Parents may wish to hold off booking vaccinations until the week of May 31st, when they will be able to book into our special clinics for families with children aged 12 to 17 years. We're now actively planning dedicated clinics for youth and families during the weeks of June 14th and 21st. And youth and parents will be able to sign up for more details by using the Notify Me program at Peterborough Public Health/Notify Me. So, but before we get to June, Let's finish up May with a bang. Our current goal is to administer first doses to 65% of all our local residents by May 31st. So with that, I'll pass it over to Brittany. Thank you.
Thank you, Dr. Salvatierra. Okay, so let's invite our elected officials if they have some updates or information to share. I believe with us today we have MP Mary Monsef and Warden Jones from the County of Peterborough with us. So let's start with MP Monsef, and I'm happy to put you up on screen if your camera is cooperating.
It is today. Thank you so much, Brittany. Is my mic cooperating?
Yep, we can hear you.
Okay, hello everybody. Bonjour, Anin, salam alaikum. I'm in my home on Mississauga and Anishinaabe territory, and as always, so grateful to you, Dr. Salvatierra, to your team, including Brittany, and of course, Mayor Mitchell, for your wisdom and your guidance in these difficult times. I'll provide a quick vaccine update and share with you an interesting experience I just had. So we've all heard the good news. As of this morning, everyone over the age of 18 is eligible to book an appointment in the province. So far, 21.8 million doses have been distributed. 18.6 million have been administered here in Ontario. Nearly, and by the way, Canada's the first among G20 countries in terms of average daily doses administered per capita. That's been the case over the past 7 days, and it's only possible because of immunizers and Canadians rolling up their sleeves and everybody else involved in this very important Canadian campaign. I want to particularly acknowledge the work of Minister Anand and the Prime Minister, who have worked so hard these past few months to secure and accelerate the pace of deliveries into Canada. We're not through yet, but our May 1st, for example, our schedules indicated that Canada would receive 2 million doses this week. Thanks to the work being done to increase vaccine supply, we're now on track to receive 4.5 million doses this week, 2.5 times more than the original amount scheduled. The Prime Minister also announced today that we'll be receiving at least 9 million doses of Pfizer in July, meaning we'll be receiving a minimum of 2 million doses of Pfizer each week until at least the beginning of August. The Prime Minister also announced $200 million as an investment in biomanufacturing funding to boost our own, Canada's own capacity to manufacture vaccines right here in Canada. This investment will go toward a facility in Mississauga and will allow this facility to produce between 112 million to 640 million mRNA vaccines each year. Here in Peterborough, those deliveries of additional supplies will be helpful. And as our colleague said at the beginning of this call, despite the good news, the continuing decline of cases in Ontario, here in Peterborough, we haven't seen that rate of decline. So it's still important to ensure we're following public health guidelines. And Dr. Salvatierra, I accept your challenge for how to spend time this long weekend. My eye is on the Canada Day long weekend, because if we get through this one, and if we continue to get everybody vaccinated with their first dose by the end of June, then Canada Day is going to feel that much sweeter. So I too encourage everybody to just hang on a little bit longer and find safe ways to enjoy this beautiful place we call home during this beautiful upcoming long weekend. On a personal note, I try to merge all my essential errands into one outing. And I had a window of time between the end of COVID committee this morning and the start of this health presser. So I put on my mask and I went outside and I went to the first place that I was going to run an errand. And there are usually these two lovely women who are professional and caring at this counter. And unlike every other time I've been there, I wasn't greeted right away. She had her back turned, and when she turned around, her eyes were red. She'd clearly been crying. She would go on to tell me that she and her colleague had just experienced a really hostile customer who refused to wear a mask. And I'm not speaking to folks who don't believe in the evidence and in the science. I'm going to speak to those who understand how essential our frontline workers have been and how difficult their job is in retail and customer service in the best of times, and how much we all have to work to ensure that they get through their difficult days with the risks they take on as smoothly as possible. So I encourage you, as you run your essential errands over the coming days, say that extra thank you to the person who's looking after you. They've got their own lives and their own challenges to deal with and their own anxieties. What we can do to help those who are showing up to work in these difficult times to look after the rest of us is respect and gratitude. Thank you to the two women that I saw today. I won't disclose what the place was, but we appreciate all of you who are going out of your way to be on the front lines for essential needs that the rest of us have. And we will work very hard to make sure that you hear and understand the appreciation and the gratitude that this community has for you. Thanks for letting me take up some space. Back to you, Brittany.
Thank you, Miriam. Appreciate that very much. Okay, so let's now hear from Warden Jones. If you have any updates for us heading into the long weekend, we would certainly appreciate hearing them. Warden Jones, do go ahead.
Okay, thank you very much. I hope I'm coming through clear. And what a wonderful story that was, Miriam. It wasn't a happy story, but I think it was pretty indicative of what we're seeing out there right now. And I sure hope people can have a look in the mirror when they do those kinds of things and just reflect on the responsibility to the rest of us. There's more to this world than just you. So I really hope we can give that a second thought. I want to send out a big thank you again to all our frontline workers, to our paramedics at Peterborough County, to our public works employees. I don't think we can say thank you enough for the people who are out there day in and day out. And you know, there's something else that I've been working on. I've been spending a lot of time on this, and that is high-speed internet. Never before have we seen the importance of getting this high-speed internet to everyone's front door, whether it's school kids or whether it's for doctor's appointments or whatever the case may be. And I've been spending a lot of time with EORN and EOWC in trying to promote our 1 gig project that we know will help so many people all through Eastern Ontario. And I got to say that Miriam has certainly been one of our big supporters. We met with her and her colleagues again the other day, trying to get the point across. I know she gets it. We need to get our provincial counterparts to get on board as well. But, you know, the clock is ticking. We've got to get high-speed internet into everybody's hands. This COVID-19 has emphasized it so much. So I just hope everyone who listens will take that to heart and really spread the word that we've got to have it and we've got to have it now. So that's been my big pressure point over the last little while, and I certainly have no problem publicly thanking Miriam for all her help on this project. So anyway, everyone, please stay safe. Let's get through this. Maybe in a month from now, we'll all be singing a different tune, but we've got to keep that guitar tuned up if we're going to do that. So let's keep her tuned. Thanks, everybody, for everything everyone's doing. Chin up. Thank you.
Thank you so much, Warden Jones. And thank you for your advocacy for improving the internet connections out in our county. Okay, let's move on to hear from our media guest today. And I'll work my way through our list of reporters who've signed on, and today we're also fortunate to have representatives joining us from the Peterborough Police Service. So Chief Scott Gilbert is here, as well as Inspector John Lyons, and we also have from the Ontario Provincial Police, Constable Joe Ayat. So if there are questions on the enforcement side, feel free to ask them as well. So let's start with Bill Hodgins from Peterborough this week. Do you have some questions for our speakers today?
Two for Dr. Salvatierra, please.
Okay.
The first has to do, I know of two people, young people, that have tried to register this morning. And the closest they have found is Cobourg in Fenelon Falls. Is there, are you getting a deluge? Are you expecting a deluge of registrations now with this? And is this something people can sort of expect?
Yes, I mean, because of the size of the population that is now eligible, we can't possibly meet that demand. And so it's not unexpected that your acquaintances haven't been able to find anything in Peterborough. I would suggest that they be patient, check back. We are loading up new appointments as we confirm the allocation of vaccine for clinics. And we're trying not to put all the clinics up at once to give our Peterborough residents more opportunities to find something closer to home. So they are free to travel if that's what they prefer to do, to Cobourg to get the vaccine. However, if they want to stay close at home, I can advise that there will be more clinics appointments scheduled and posted, and that they will be able to book, but it may take waiting a few weeks to actually get that appointment, as we are completely booked for the rest of the month and are now booking into June.
Thank you. And the other question, and again, I know you're limited what you can tell us, but what can you tell us about the latest death in terms of age? Was it home or retirement home? Did they have vaccination?
Right. Okay. So again, another tragic loss for the community. Someone who lived in the community in their own home, and who was exposed through close contact, and had some underlying conditions that put them at greater risk. But it's always sad when we lose a member of our community.
All right, thank you very much. That's good for me.
Okay, thank you, Bill. Let's hear from Jessica Nisnik. Do you have some questions today?
I do. Thanks, Brittany. Hi, Dr. Salvatierra. So I don't know if you mentioned this already about the latest death. Did you say when it occurred?
I believe it was 2 days ago, Jessica. I believe it was on Sunday.
Okay, thanks. So Dr. Salvatierra, I think you've already gone over this, but I'm getting texts and emails from friends and other people. I can't get in, and you've just discussed it. I don't know how we're gonna hit this message home. Do you know how many appointments you can, I know Bill was just asking about this, how many appointments you can open a day, or how many you plan to open a week, or what can we tell these people that are still freaking out?
Tell them that we're in the bottleneck right now, because remember, we only got our vaccine supplies doubled Monday. We're only we're the next day. As of tomorrow, we are increasing our capacity. And as of this week, we are getting more vaccine than we've ever had before. So I would just say check back, be patient, check back. We don't load up all of the appointments at once. And part of the reason for that is we don't want them scooped by people outside of Peterborough, because you can book into clinics anywhere. So we're trying to be more strategic, divide them up and put them up on the website, hoping that our local residents are continuing to check back for appointments, and we'll be able to get one of those appointments when we are able to post them.
All right, well, you just led me into another question here. I know people can go wherever they want to get the vaccine, but I know people are also going to be, why don't we keep people out of here? This is our vaccine, because you just said it can open to other people. Can you just remind people if we can go other places, it's fair for anyone to come here?
Well, because it is a provincial vaccine rollout, anyone in the province is eligible. We do want to make it convenient. So we know people live and work in different places. So you might work in Port Hope, but live in Peterborough. So sometimes it makes more sense to be able to access the vaccine closer to work. We know our seasonal residents will be here soon in June, and that they may have second doses, and rather than driving all the way back home, it makes a lot more sense for them to get those second doses here. So we've built in that flexibility, but remember, it is a stay-at-home order right now. People aren't supposed to be out and about. You're supposed to stay close to home, and so I would add to that, stay patient. There will be lots of vaccine available. There will be appointments opening in June. So if you don't mind waiting a few more weeks and come and staying local, you'll get your vaccination done here. We're very friendly in Peterborough. The clinics are a great experience. What else can I do to sell local, Jessica?
I think you've done it. I think you've done it. The people just don't want. Residents just think these are our vaccines. We don't want other people coming in, but yet we can travel. So are we getting 7,000 doses a week of Pfizer, or what are we getting now?
Yes, we're getting 7,000 a week of Pfizer. In addition, we're getting more Moderna. And we expect that the amounts of vaccine are going to be increasing even more in the next few weeks.
And since you've mentioned Moderna, any other issues with that? Are people still, no? Has that gone away?
I don't know if it's gone away. I personally don't have any issues. Moderna is a great vaccine. I would say it's as good as Pfizer. This is a Pepsi, Coca-Cola kind of thing, I think, and please, let's not get caught up in brands. They are fantastic vaccines, better vaccines than we've had in a long time against many other illnesses. And we're fortunate to get either Moderna or Pfizer right now.
Perfect. And just to clarify what I meant by go away, I meant the people that are walking away from it. Hopefully we'll never lose Moderna.
Yeah.
Yeah. That was it. That was it for me, Dr. Salvatierra, but I do have my colleague Katrina here today, and she wanted to ask you a question as well. We always all jump on when we know you're going to be available.
Okay.
Thank you. That's it for me. Here's Katrina.
Hi, Dr. Salvatierra. Shoppers in the province is now offering rapid tests, and I'm just wondering what your thoughts are on these rapid tests and in what situations people should use them.
Now, Katrina, are you referring to the rapid antigen tests that are available for people who are asymptomatic?
Yes.
Right. So there are individuals for whom this testing is being provided. For example, if our schools reopen in the next few weeks, there may be staff or students who prefer to have a rapid antigen test, and they will be able to access them. They are not meant to be used for anyone with symptoms. So if you have symptoms, do not go to Shoppers Drug Mart. Go to the assessment center or the Norcrest to get tested. And they are not intended to be used in an outbreak. So if you are, let's say your workplace is in an outbreak, you should not be going to Shoppers Drug Mart for a test. You should be going to Northcrest or Assessment Center, and we would be advising you where to go. So there is a time and a place for asymptomatic testing as a screening for people who are well, but it has its limitations.
Okay, do we know what these tests look like? Are they like the swab up the nose or at the back of the throat, or what? Yeah, what do they look like?
Most tests can be used in a variety of ways. And yes, you are correct that a throat swab or a nose swab is typical for the antigen tests. So the answer is yes. A variety of methods of collection can be used.
Okay, thank you for answering those questions regarding the test. And is Brittany, did you say that Constable Joe Ide is on as well?
Yes, he is.
Okay, then I have a question for Constable Ide. I think with the long weekend upon us here, there is concern about travel, potentially people coming from other regions. So when it comes to enforcement around that for this long weekend, what will that look like, and will there be increased enforcement regarding that?
As of every long weekend, we tend to increase our patrols. We've created a detachment level initiative in regards to Burley Falls already, because that was a huge issue last summer. So we're already increasing our patrols in that area. Over the last little bit, we've been receiving complaints of camping on Crown land. So we've increased patrols of those areas. We are aware of issues, and our patrols will be increased this weekend and in the summer.
Okay, thank you.
Okay, thank you so much, Katrina and Jessica. Maybe to round out our global reporters, let's hear from Greg Davis if you've got some questions.
No, I'm good today, Brittany. Thank you.
Okay, so let's move on to Paul Rellinger then. Do you have some questions for Dr. Salvatierra or any of our enforcement partners?
I do, Brittany. Thanks so much for Dr. Salvatierra, if I could.
Okay, just a second. There we go. There we go. There, go ahead.
Hi, Dr. Salvatierra. How are you?
Good.
I just, I know you've already spoken to it, and it's difficult to speak to. On the person that passed away, were they vaccinated, similar to the other recent deaths?
Yes. Unfortunately, the person had one dose of vaccine, but again, I believe the underlying conditions probably were an impediment for an immune response, as this person developed COVID-19, ended up in the ICU, and unfortunately has passed away.
Okay, thank you for confirming that. I wanted to ask about the Astrazeneca vaccine. Have we heard any more on what's happening there, and if we're going to get any supply at all?
We haven't, Paul, but I did hear from Dr. Durkheim last night in another meeting that he was expecting a decision to be made in the next few days. So potentially by Friday, when we are back together, if there is any news, I'll certainly bring it.
Perfect. And I just wanted to kind of go back to what you were saying at the beginning about that under 29 age group, that 20 to 29 group. Is it fair to say, when we look at our numbers, and as you pointed out, rightly so, an alarming somewhat increase compared to the province, for sake of a better word, that is the culprit group? That's where you're seeing the most cases?
The most cases, but keep in mind, for example, our latest deaths were people in their 70s. And again, where socialization or close contacts put them at risk. So, but definitely the majority of our cases are young. They are in the workplace. They are working at jobs where they're essential services. They don't have sick pay, so they tend to go to work even when they're not feeling well. Many of them live together in shared accommodations where they're sharing bathrooms and sharing kitchens. It's so they're in close contact, in close quarters. So that's the group I really would like to see immunized now that we are able to give vaccine to 18 and over.
Okay, perfect. And just one more thing. I wanted to, and I know we're not even really near that point right now, but I mean, potentially, if our numbers rise, I guess it could happen. Are we in danger of approaching or nearing being a hotspot, similar to what we saw in other parts of the province? Is that a concern in the back of your mind? And if so, what are the implications of that?
No, I don't think we're near to being a hot spot. We don't have the density of population or the other characteristics and the historic trends, but we are near to being overwhelmed. And that's not good either, because if you overwhelm public health and we aren't able to get to the cases within 24 hours and we're not able to isolate their close contacts right away, we will have more spread. And so right now we need to protect our public health capacity so that we are able to respond same day to our cases. And double digits, cases in the double digits seriously threaten our potential. We are throwing everything we can at case and contact management right now, but we also have staff who are immunizing, and we're back to immunizing 7 days a week. We cannot do it all. And so one of the reasons I'm asking the community to follow the requirements and stay at home and not socialize indoors is that we are really at that point of being overwhelmed, and that would only mean more spread. So we're trying to protect what we have in order to protect the community better.
Great. And I just wanted to clarify one more thing. With vaccinations, the best way to get an appointment is still to call that provincial call center number?
No, I'd say the best way is to go online and go directly to the booking system online. And even better, sign up for Notify Me. Because if you sign up for our email service, we will notify you as appointments become available. We can use that way so that people don't need to worry and that they may miss out. So online is definitely fastest and most convenient. You can do it around the clock. You don't need to have somebody answer a phone and help you. So if you can go online, that's the best way to access.
Perfect, Dr. Salvatierra. Thank you so much.
Great, thank you very much, Paul. Okay, let's hear from our examiner colleague. So Joelle Kovach, do you have some questions today?
Just to follow up on Paul's question, did you just mention that the health unit is vaccinating 7 days a week? Like, does that mean that the mass vaccination clinics are doing so already?
Yes, so starting as of this week, Joelle, we're back to 7 days a week because we now have enough vaccine to do that. We've also reactivated the PRHC vaccine clinic. And so they've started this week with the highest risk healthcare workers. And we are in active conversation with our primary care providers about doing evenings at our immunization clinics. We're also shifting, as you know, to the ice pad to give us more capacity. And I know that this week our pharmacies here in Peterborough are getting more Moderna and more Pfizer even. So and that will only grow. So there should be lots more pharmacy capacity in the weeks ahead as well.
Oh, excellent. Now, when you say that doctors are being contacted about potentially doing evening clinics, do you mean like at their own clinics or at the Everrood?
No, we've been in conversation with all of our primary care providers, so our physicians, nurse practitioners, about running evening clinics at the Everrood. We're just in the process of setting those up and getting them scheduled. And as soon as that happens, those appointments will be opening up online.
Ooh, that's very promising. Thank you so very much. That's great information to add. Thank you. I also have a couple of questions. I'd like to follow up with Peterborough Police about, well, it was another weekend, and I'm wondering about any charges that may have arisen coming out of either the Nichols Oval or the anti-lockdown protests, please.
Did you have any comment on that, Chief Gilbert, or should I pass this along to Inspector Lyons?
Inspector Lyons.
Okay.
Thanks, Chief, and thanks, Brittany. And yeah, so Joelle, we have laid 3 charges on the weekend, and there is still follow-up to be done regarding more charges from the City Hall protest, as well as the gathering at Nichols Oval. There is potentially more charges to be laid in that situation as well.
Okay, so are all 3 attached to one or the other of the gatherings, or what's the breakdown?
So the 3 charges that were laid at the City Hall protest, and there's, as I say, there's potentially more charges to be laid for that situation, as well as the gathering at Nichols Oval. But no charges laid as of yet for the Nichols Oval.
Okay, thank you. But there's follow-up taking place, right?
Correct.
Okay, excellent. Thank you very much.
You're welcome.
Brittany, I apologize. There's suddenly a lot of background noise in my space. I would like to see if Warden Jones is still on the line, though.
Okay, let me see if he's still. I think he's had to step off. I don't see him on my participant list right now, so my apologies.
Okay, that's okay. I'll follow up with him. I was, unless someone else can comment on whether there's been a lot of travelers already arriving.
I think that
I doubt it.
The question might be best for him, so perhaps
I will direct that to him. All right, he can be reached afterwards. Thank you.
Okay, great, thank you. So let's finish up with the examiner, and Reg Watson, do you have any questions for our speakers today?
Is there a specific timeline on when this move to the ice pad at Evinrude Center will take place?
Yes, we are hoping to get access at the beginning of June. It's going to take us a couple of days to get the HVAC system installed. We're putting in HVAC in order to operate safely there. And then we will open it up. So it'll be first week of June.
And that won't pause the clinic? You just simply shift over on the next day?
I'm not sure of that. I'm not sure unless Brittany knows.
I think it will lead to a bit of downtime for a couple of days. I understand the last day the clinic runs is the 1st, and then we reopen on the 3rd. But
Thanks,
the other clinics and the pharmacies continue to operate.
Okay, thank you.
Okay, great. Thanks, Reg. Okay, let's hear from Matt Latour from our local radio stations. Go ahead, Matt.
My questions today are for Dr. Salvatierra. I know the province originally, the 18+ appointments weren't supposed to open up until next Monday. When they kind of pull the audible and say we're able to do this tomorrow, does that affect public health at all? Does it overwhelm you guys at all, or is it a welcome announcement because it means more people can book?
It's both, Matt. I mean, for us, because of the fact that we've not had the same access to vaccine until now, we have a backlog. And so opening up the appointments creates a demand that we can't meet. And we are really counting on people's goodwill and patience here in Peterborough. But it's wonderful news. I mean, as you see, I mean, our cases in young people are very high. So the sooner we can get vaccine to break that transmission, the better. We all wish we could have as much vaccine as we could as we want and need, but it is getting better, Matt. We're going to be a month from now. We're going to be in such a different place with so many of our people protected with at least one dose. It's very exciting.
Looking at, there's a lot of, it looks like very promising things coming between moving to the ice pad and having, evening appointments as well. will more people getting vaccinated, is there any chance that second doses kind of get moved a little closer, or is what's booked right now kind of what's set in stone?
No, we anticipate that second doses will get moved up as vaccine supply becomes more available. So first doses is still a priority for us, reaching as many people as possible with first dose. And the youth are a priority. We want to get the youth done before school is over for the year, so that we can capitalize on the assistance from our school boards and school principals. But then it will be second doses. So we should see, I would think that it's a reasonable expectation that we, people with appointments right now for a second dose will see those appointments moved up, and that they should be able to get vaccinated sooner than they thought.
Once the clinic is moved, over to the ice pad and you have the evening appointments kind of up and running in full swing, do you know what the capacity for total vaccinations in a day would be, given you have the vaccine?
It's well over 1,000 a day. I believe it may be about 1,200 a day once we're on the ice pad.
Perfect. And you mentioned some pharmacies now are getting Pfizer and Moderna. I know those need to have like deep freeze storage. Are they all equipped to do that?
No. So what will happen with the Pfizer and the Moderna that's coming to Peterborough is that it is shipped frozen. But once it arrives in the pharmacy, it's kept in their refrigerator where it will thaw. Once Pfizer thaws, it must be given within 5 days. When Moderna thaws, it must be given within 30 days. So these pharmacies need to administer that vaccine into arms in those short windows while the vaccine is still stable at refrigerated temperatures.
Perfect. And is there any update on any further clinics out in the county?
We will be scheduling clinics in the county. We're just planning now, still looking to see whether some of those might be related to those family clinics that we will be hosting for students and their parents, the June 14th and 21st. So there may be some in that period. And then, of course, once we get to second doses, we will be back in the county.
That's it for me. Thank you.
Great, thank you very much, Matt. Okay, now, and last but not least, we have Trent Radio joining us today. So Rob, do you have any questions for our speakers?
Hi, thanks, Brittany. I just have one question for Dr. Salvatierra. I think you mentioned, I'm just looking for confirmation here. You mentioned for the Notify Me tool a little while ago. Is it the case that it would notify, if you're eligible, let's say someone became eligible today but wasn't able to get an appointment, would that tool notify you when more bookings became available in the future, or is it just the one time you're eligible now?
I'm going to ask Brittany to answer. I know we've used it in a couple of ways. So Brittany, yes. Would you like to take that?
Sure thing. Yes, thank you, Rob. Notify Me was designed to alert people when their age band became eligible for vaccine. So just this morning, for example, we did send out an email to everyone who had registered from the 18 to 44 age band. It was over 7,700 emails that went out today. So it's been designed to be that first notification. That said, there may be merit in reminding different age bands, especially if we start experiencing vaccine hesitancy, in letting them know when we have more appointments available. But at least we've been able to send out the initial communication so that everybody who signed up knows that now they can go to the provincial system and book their appointment.
Okay, great. So for someone who, say, became eligible today but wasn't able to get an appointment, I guess the best message for now would be, if you're looking to get it locally, just to check back periodically rather than waiting for another notification.
Correct. Yes, just keep checking back and more will become available.
Okay, perfect. Thank you very much. That's all for me.
Okay, great. So I think that wraps us up then. So thank you all for your good questions. Thank you to our speakers for your wonderful comments and answers today. We look forward to having you back on Friday as we continue to enforce the and encourage the guidance for going into the long weekend. Thank you for your help in encouraging people to lay low and stay at home so that we can get through this together. Take care, everyone, and we will see you back here on Friday at noon. Bye-bye.
Thanks, Brittany.
Thanks, Brittany.
Thank you.
Thank you, Brittany.
Thank you, Brittany.